your next door nurse. So guys, in today's video we are going to be talking about irregular periods or menstrual irregularities. Please, if you are new to this channel, kindly subscribe to the channel, click on the notification button so you never have to miss any posts from us. So let's get straight into the video. Okay, so menstrual irregularities are a group of disorders or group of abnormalities that happens during the course of a woman's period. Now, I've made a lot of other videos where I talk about normal periods, signs of ovulation, and I try to explain how a normal cycle should vary from 21 days to 35 days. That is the normal range of a normal menstrual cycle. So menstrual irregularities could come up with a lot of symptoms, like the things that should make you know that your period is not normal, and that ranges from severe pains or cramps during period that comes with big clots. It could also come as periods that last longer than 7 days or less than 3 days. It could also come as your period skipping for 3 times in a row when you are not pregnant, you are not breastfeeding, you are not on any hormonal therapy or contraceptive pills, and also you are not on the course of menopause or menarche. Now, menopause is the process whereby a woman stops seeing menstruation, and menarche is when a girl child starts seeing menstruation. It's normal that when you are on the course of menopause, your period may skip for some months, and the same thing applies to menarche. So these are some of the things you would see and know that your period is abnormal. If it lasts longer than 7 days, it's very heavy, heavier than usual, is lighter than usual, shorter than 21-day cycle, or longer than 31-day cycle, comes with cramps, comes with nausea, vomiting, and it comes with bleeding or spotting that is not associated with that is associated with menopause or following sex. So these are the basic symptoms of menstrual irregularities. Now we are going to be talking about the causes of menstrual irregularities, because definitely there must be something that leads to an abnormality. So now we are going to be talking about the causes of menstrual irregularities. Now I'm going to try to classify them or categorize them into two. We have the ones that are not caused by underlying factors, and the ones that are caused by underlying factors, most specifically some disease conditions. So the first one under the one that is not caused by underlying factor is physical stress, change of environment, lifestyle changes, diet modification, medications. Family history is very, very important. It should have come like on the first, should have been the first thing I mentioned. Family history is very important to know that even if you don't have an underlying disease condition, if you have someone in your family, maybe your mother had menstrual irregularities, or your sister, or anybody at all in the family, it doesn't really have to be an immediate relative, but it runs in the family. So family history is like number one. Physical stress, traveling, being on medications, and I've mentioned a whole lot already. So those falls under. Smoking too is also part of the causes of menstrual irregularities that is not caused by a disease condition. So these are all things that could make your period become shorter than normal. If you are trying to check your weight, exercise, rapid weight loss, and all of that, they could add to you having menstrual irregularities. So other than that, we now have the factors or the causes that are related to underlying factors or underlying disease conditions. Like the first one is uterine polyps or fibroids. This is like the first on the row. It's like a growth in the uterus that causes menstrual irregularities. I do not really want to talk so much about the underlying factors, the disease conditions, because they are broad, so I'll just mention them. You can also do your research, and subsequently I'll bring them on to the channel. We have endometriosis, we have PCOS, that is polycystic ovarian syndrome. We have pelvic inflammatory disease, PID, generally known as PID. This is like a group of disorder or a group of infection that affects the woman's pelvic organs. Then you also have uterine cancer or cervical cancer. You also have complications that arises from pregnancy, such as miscarriage or an ectopic pregnancy. You also have premature ovarian insufficiency. So basically, these are the underlying factors or disease conditions that can pose on to having menstrual irregularities. They are all broad. Most of them are linked to hormonal imbalances, growth in the uterus, shedding of the uterus like endometriosis, and this group of underlying factors could definitely cause menstrual irregularities. So we have talked so much about menstrual irregularities. Let's now know the types of menstrual irregularities. So we have three major types of menstrual irregularities, and they are amenorrhea, oligomenorrhea, and dysmenorrhea. Now, amenorrhea, let's start with that, is the absence of a woman's period. Like your period ceases for like 90 days. 90 days is 3 months straight. Your period ceases, and you are not breastfeeding, you are not pregnant, you are not going through menopause or menarche, you are not on contraceptive pills, and so you just have the cessation of your period for this number of months, or for this number of for this period of time, for 90 days or more. That is what is referred to as amenorrhea, the cessation of a woman's period, complete absence of a woman's period for more than 90 days without the woman being pregnant, without her breastfeeding or going through menopause or menarche, or being on any kind of contraceptive pill. Then the second one is oligomenorrhea. Oligomenorrhea is an unstable, infrequent period. For example, someone that sees her period this month for 3 days, and next month she sees her period for 5 days, or she has a cycle of 21 days this month, and the next month she has a cycle of 35 days. It just fluctuates back and forth. It is called oligomenorrhea, and that is an irregularity. It is an abnormal period. Then the third one is dysmenorrhea. I think this one is really common. It's like the most common of them all. It has to do with pains, severe pains, cramps, and heavy bleeding, and also you may have clots in the period, like the blood comes out with heavy clots. It is called dysmenorrhea. Now, a lot of women have painful menstruation, but being extremely severe and presenting with cramps, with nausea, with vomiting, with tiredness, with dizziness. Some persons actually faint during that process, is something that you should treat as an abnormality. So guys, it is important that we talk about the diagnosis, even if I'm not going to go very in-depth to it, but I'm still going to mention how to find out that really you have menstrual irregularity. We have a lot of tests that could be carried out that varies from pap tests, blood tests to find out if you have anemia, because anemia could equally lead to menstrual irregularities, like you not seeing your period or missing your period. Severe anemia could cause that, and also pregnancy is also something that could make you not see your period. But if you are not pregnant, then you shouldn't miss your period. So that is why you should have a blood test done, a pap test. Paps may already know what that helps us to do to find out if there are cervical cancers or not, if there are growths. Then also have biopsy done, cervical biopsy done, where a portion of your cervix or the uterus is taken out. And even for culture, also have vaginal cultures that are done to know if there are any kind of infection. Now, physical examination by the doctor is very important. That is also done. And scans, pelvic ultrasound also helps to find out if there are growth, abnormal growth, endometriosis, and all of that. So these are the basic ways to find out or to be diagnosed of menstrual irregularities. Okay, so the next thing we are going to be talking about now is the treatment course, because everything, as long as it could be prevented, also has a treatment option. So we're going to be talking about the treatment. So it is very important to talk about the treatment options for menstrual irregularities. Note, this is not me telling you to self-medicate or not consult your physician. I'm only trying to enlighten us or educate us on the treatment options so that you at least have an idea of it. Now, I'm just going to categorize the treatment options. I won't go into details. I'll just mention them. Into medication. Medication involves pain control and hormonal therapies. These are ways that could be used to control or treat the menstrual irregularities. You could have pain medications given for dysmenorrhea, for excessive pains or severe pains. Endometriosis is also controlled with pain medications, and also hormonal therapies is a very, very important treatment. Then you also have surgery. So basically, medications and surgery. Surgery goes for especially fibroids. Okay, and then we are going to be talking about the prevention. How can you prevent menstrual irregularities? Let's rule out family history, physical stress, and all of that. There are still ways you can prevent these things from becoming extreme. The first one is trying to maintain a healthy lifestyle by exercising, eating nutritious foods, taking enough rest. Stress reduction and relaxation techniques is very important. Then modify your exercise. As an athlete, you don't have to go to the extreme. Also use birth control pills or other contraceptive methods. Change your tampons or your sanitary pads approximately 4 to 6 hours. This will help prevent infection. And of course, I talked about PID as an underlying factor or an underlying cause of menstrual irregularities, and this is very possible from not having a good personal hygiene, not changing your tampons or your pads at the times that you should. It makes microbes or bacteria have a very nice and convenient place to strive. So change your tampons or pads approximately 4 to 6 hours to avoid toxic shock syndrome and also infections, and also see a doctor when you should. So guys, I hope you really learned a lot from this video. Okay, we've said a whole lot about menstrual irregularities. I know that there are 1,001 women that are going through these conditions, and I'm encouraging you guys to keep up with your health. Always tune into our channel and get informed for free. Actually, all I need you to do is to subscribe to the channel, and we'll keep you updated with health tips, with health information, and everything that has to do with your health. So guys, this is where we'll be drawing the curtains. I hope you learned a lot. Please, if you enjoyed this video, give it a thumb up, subscribe, share, comment, and I'll see you in my next video. Thank you. Bye.